Melanoma. It's very important in AMC exam, so please take care of it. It's very important. The keyword for melanoma is as following. Any black discoloration of the skin is melanoma until proved otherwise in AMC exam. Okay? Look at the pictures. All of them are black discoloration of the skin. So, any black discoloration of the skin, it's melanoma until proved otherwise. Important note, please keep this in your mind. A black discoloration of the skin with ulceration in the face, it's basal cell carcinoma, not melanoma. Remember this information. I talk about this in basal cell carcinoma. Any ulceration in the face, even if it's black in color, it's basal cell carcinoma, not melanoma. But if just black discoloration without ulceration, then this is melanoma. Okay? For risk factors. The highest risk factors for melanoma is patient with history of atypical nevi. Focus on it, atypical nevi, not any nevi, it's atypical nevi. And the second highest risk patient for melanoma include positive family history of melanoma patients. Okay? Now, what is the most important prognostic factor in melanoma? The most important prognostic factor in melanoma is the depth of the tumor. Okay, not the size, not the shape, not the feature of tumor, it's the depth of the tumor. This is the most important prognostic factor in melanoma. For spread, melanoma can spread locally to the local lymph node or distant lymph node or to the distant organ, including liver, brain, or any other organs inside the body. Okay? For investigation, always start by excisional biopsy, which is taking 2 mm from the margin of the tumor. For treatment, the surgery is the main line of treatment, including wide excision, 2 to 3 cm from the margin of the tumor. Please focus on the number because it's very important. Surgery is the main line of treatment in all stages of melanoma. Okay, whatever the stage, the surgery is the main line of treatment. If you remove the tumor and the margin still contain malignant cells, then the next step is re-excision, okay, until the margin will be free from any tumor cells. For melanoma near eyelid, the next step is refer to plastic surgeon. It's not your business, okay, if the tumor near the eyelid. A very important note. History of melanoma, and now the patient came to you with features of raised intracranial pressure. What is the cause? The cause here is melanoma metastasis to the brain until proved otherwise. Any patient with history of melanoma and came to you with features of raised intracranial pressure, it's melanoma metastasis to the brain. It's important. History of melanoma, and now the patient came with back pain without any history of trauma, then this is melanoma metastasis to the vertebral column. Okay? For prevention, the most important advice for prevention is avoid sun exposure, especially between 10 a.m. to 3 p.m. It's the best advice for prevention of melanoma. For screening, there is no screening for melanoma. But for high risk group, use photography follow-up. I mean, take photograph of any nevus or any black discoloration of the skin and follow it. This is done only for high risk group, not for all population. And in general, there is no screening for melanoma at all. So finally, remember, for investigation, use excisional biopsy, taking 2 mm from the margin. While for treatment, use wide excision. I mean 2 cm from the margin. That's all. For full course, please contact us through amcqbook@gmail.com. Thanks and goodbye.